There's a lot of myths out there about hearing loss, and it's time to set the record straight. This is Sound Advice with audiologist Doug Leonard from ASI, Audiological Services of Iowa. First of all, Doug, Jody M. was the winner of the quarterly prize package, the first one, so we want to say a quick congratulations to her.
Yeah, congratulations to her, and then we're going to be doing that again quarterly throughout 2024, so make sure you get registered for that.
Go to their Facebook page because they've got an interesting article there talking about the myths and facts about hearing loss. And it is crazy. You think in 2024 that we'd be beyond some of these myths, but we're not. One of the big myths is like, my doctor has not told me I have a hearing loss, so I guess I don't.
Yeah, we trust our healthcare professionals, which we should, of course. I'm one of those as well. But, sometimes hearing loss is one of those things that isn't typically acute, meaning it's something that comes on gradually. The patient doesn't notice it as much. Their family maybe complains about it. And in a healthcare setting, think about seeing your primary care physician or provider. You could be sitting in a room. You're typically in a small room having a conversation about whatever took you in there, and it probably isn't hearing loss. And so it might be hard for that professional to identify that problem when they're sitting, very close to you, quiet environment. Most people can hear in situations like that. I will say that one thing I've really noticed in both my Carroll practice and Audubon and Atlantic is how many physicians now do refer, though. They are paying attention to that. I mean, the information is getting out there about what untreated hearing loss can do to our quality of lives and our other healthcare issues. And so I am very happy with how health professionals in our three towns have really encouraged their patients to come in and see us.
Also, the big myth that hearing loss just doesn't affect my overall health is completely wrong.
Yeah, we've talked about that a lot on Sound Advice, about the different comorbidities and either things that can contribute to hearing problems that people don't always associate with hearing loss. It could be diabetes, it could be heart disease. Those are things that can cause people to lose their hearing more quickly than normally. And it's also the comorbidities, thinking about things like cognitive issues and disequilibrium, balance issues that hearing loss can contribute to. And, folks are much more likely to suffer a fall, for example, if they have hearing loss.
Another one is hearing loss cannot be prevented, which, again, you think about it for a couple seconds, that's totally false as well, but people believe that.
Well, it depends on the type of hearing loss that we're referencing. Age-related hearing loss, obviously, it can't be prevented. We want to keep getting older. But there are certainly conditions that can contribute to hearing loss that we can prevent. Obviously, noise exposure is one of them. People that work in a noisy environment, and it doesn't have to be incredibly noisy, but if you do it day after day for 8, 10, 12 hours a day, it will cause damage. And that's why people need to be using hearing protection. They need to stick some earplugs in or wear earmuffs to prevent that thing that they can definitely avoid.
Yeah, you've always said the best hearing protection is what you have available right now. And get it checked yearly. A screening is the way to go with ASI. Doug, what's the phone number here to set that up, and how long does it take?
Yeah, an appointment could be, anywhere from 30 minutes to an hour, depending on what we find and what we need to talk about. But they can give us a call in Carroll at 792-5933.
It's just that simple to keep up on your hearing and really just keep up your quality of life with ASI, Audiological Services of Iowa.